Oral health forms an integral part of personal hygiene for all of us, but it is often neglected in children. Parents believe that cavities in babies' teeth wouldn't matter as they'll be shed down by the body in the months to come. It is important to understand that it is not true. Bad oral hygiene can lead to dental decay in children and even cause severe dental problems when they grow up. Hello and welcome to GIIS podcast, The Smartcast. I am your host Shweta Bhatia, and today we will be discussing about the importance of oral hygiene in children and how can we inculcate good oral habits in them from early on. And to share some tips and meaningful insight on the topic, we have Dr. Fareha Hamid with us. She is a MDS in Oral and Maxillofacial Surgery and has worked with many hospitals and dental clinics of Delhi, NCR as a consultant for over 12 years. Welcome, Dr. Fareha. It is a pleasure to have you with us today.
Thank you, Ms. Shweta, for the wonderful introduction. Well, all children are special little beings, and as parents, I'm sure you must remember, or you remember how adorable your baby looked when those two tiny little front teeth emerged. And soon there's a full blown smile, and also a reasons to start caring for them. Now, the presence of milk teeth begs one very important question to all the parents. Do milk teeth actually require special care? Anyways, they're eventually going to fall out and make way for the permanent teeth. So this talk is about this $1 million question. So yeah, let's begin.
So, Dr. Fareha, my first question to you is what is oral hygiene?
See, the oral cavity includes the structures like the teeth, the gums, the tongue, and keeping them clean is referred to as oral hygiene in very simple terms. And parents, they should start maintaining the oral hygiene of their child within a week after their birth.
The next question coming up is why is oral hygiene important and why it must be inculcated in children from early on?
Well, oral health problems include cavities, gum disease, halitosis or bad breath, and many other issues. So the best part is that we can stop these problems before they even start by taking proper care of the teeth and the gum. So it's basically a preventive care. Now there's something which we may not be aware of is that the oral health is very, very closely related to our overall body health. So, say for example, if there's an infection which is present in the oral cavity or the mouth, then the bacteria might spread through the bloodstream into the other parts of the body and might lead to other health concerns as well. Now, we will discuss, first about the primary and the permanent dentition, and then I'll come on to, how and why it is important to take care of the primary teeth. I'll cover that.
The next question is what are the signs of poor oral hygiene?
There are certain warning signs of poor oral hygiene, and we actually have to keep an eye on them. And they could be like, the bleeding from the gums. The gums can recede. Receding gums meaning to say that the gums start shifting and leaving the teeth. Then there can be a chronic bad breath. There can be decay of the tooth, the loosening of the tooth, and there may be, toothache or worst case scenario, swelling of the jaw, or sometimes, you can have non-healing mouth sores as well.
Very well said, ma'am. Let's move on to the next question. How can we differentiate between milk teeth versus permanent teeth? And why does milk teeth needs special care?
You will find it amazing to learn that the formation of the milk teeth starts in the womb itself. So the milk teeth, they start forming when the fetus is just 6 weeks old, and they usually get completely formed during the second trimester of pregnancy. And so even though it may look like your baby is born without teeth, they're actually hiding underneath, waiting to erupt. So the milk, they start eating at about 6 months of age, and that almost all of them, they get erupted when the child is about 3 years old. So we all know that by the age of say 5 to 6 years, the milk teeth, they start forming. And they start forming when the child is about 3 years old. So we all know that by the age of say 5 to 6 years, the milk teeth, they start forming. So we all know that by the age of say 5 to 6 years, the milk teeth, they start forming. then they fall out and they start making way for the permanent teeth. So this shedding and eruption pattern, this continues till the age of 12 to 13 years of age. So what is worthwhile noting here is that the milk teeth actually remain in the mouth of the child till they're 12 or 13, 12 to 13 years of age. So that is why we need to take proper care of them till this time. And talking about the uniqueness of the milk teeth, we actually need to learn that they are unique in certain ways, because then only we'll be able to take proper care of them. The first unique feature is that the outer covering, the white portion of the tooth that we see, that is the enamel, that is very thin and soft in children. And because of that, the pulp chamber is of larger size. Pulp chamber in the sense where the nerves and the blood vessels of the tooth are present. So thin enamel covering, larger pulp chamber, these two factors actually contribute to the rapid spread of caries in children. And a very important thing to note is that if the child has caries in their milk teeth, then they're 3 times more likely condition. So this is one important feature. The second important feature is that their roots of these milk teeth are very small and they're very thin. So that is the way they resorb, faster, and they actually shed off to give way to the permanent. So these two are the, and talking about why the milk teeth need special care. Well, to understand, why a certain thing needs special care, we need to understand the roles of that particular thing first. So as most of the parents, they think, the milk teeth are anyways going to fall off, and not much. I mean, why to take so much of care about these teeth? They're eventually going to fall off. The permanent ones are going to come. So as I earlier mentioned that the milk teeth actually remain in the mouth for say around 12 to 13 years of age. So you have to take care of them. And as said, that the first, and as everyone knows also, the first and the foremost function is to actually reserve the space for the permanent. So this is the foremost function. The second very important role is that, again mentioned previously also, that if the child has caries in their primary dentition or the milk tooth, then it is very likely 3 times more risk of developing caries in the permanent dentition. So they actually influence the health of the permanent tooth also. And the third role is that the teeth, they support the lip, so they contribute to the facial profile. So they're very important for the aesthetic facial appearance also. Fourth important function is the development of speech. When we speak, the milk teeth or the teeth, they control the airflow out of mouth, so they help the kids to speak. So basically the transition from I thought I saw a puddy tat to I thought I saw a pussy cat basically is because of this, the presence of these milk teeth and the control of the airflow, and helping them develop their speech. So basically healthy and well aligned teeth, they will they improve the word pronunciation, the language development. Whereas on the other hand, if they have malaligned, they have painful teeth, then it can lead actually to a garbled speech, or to a lisp. So again, the kids who lisp as toddlers, they are considered very adorable by adults. But at the same side, on the other hand, it can lead to problems with learning, self-esteem, and social skills if they lisp. If the lisp doesn't, when they're growing up, if the lisp doesn't go off while they're growing, then it can lead to certain problems, like I said, regarding their learning, their self-esteem, or their social skills. Another important function is that when the child is growing, the digestive system is also developing. So they need healthy teeth to chew the food properly, for the nutrients to be absorbed efficiently by the digestive system. So similarly, if the teeth, they are, if they have some decay, or there's pain, there's problem in the tooth, they will not be able to efficiently chew their food. And again, the consequence would be on their general health as well, because they will not be taking the food properly, chewing it, nutrient absorption. And another goal is that, aid in the development of the jaw. So firstly, as I said, that they help in the proper eruption, in the so that the permanent teeth, they erupt in proper position and proper direction in an appropriate place where they're supposed to erupt. And apart from that, they help the child to breathe through their nose. The child will keep their mouth closed. They also aid in the positioning of the tongue. So positioning of the tongue, breathing through the nose, closing their mouth, eruption of the permanent teeth in proper place. So all these factors, they again contribute to the development of the jaw. And that will actually help the parents save money in future, because otherwise they have to invest money, the orthodontic treatment, the braces treatment, what we call. So that is also one reason I need to, I need to take care of the prime. And last but not the least, they are confidence boosters. So, we adults might love to see a child with a big, goofy grin with, missing teeth or malaligned teeth, but it is not the same, with the child, with their friends and playmates. So that can again, lead to low self confidence, and that can affect their school performance, their social skills. So overall, I would like to say that I stated these many roles, and it is very, very important, to take their utmost care of them. And the negligence can have more consequences than expected.
Thank you, ma'am, for the advice. This will surely help all the parents. How can parents maintain oral hygiene age wise in their children?
Now that we know that the milk teeth are important and we know the roles, so how to take care of them? So usually in infants, like say 0 to 1 year age, the gum pads are there. There are no teeth. We What we need to do is we need to clean and massage the gum pads using a moistened gauze piece or a wet cloth, and this has to be done after every feed and every night. It has to be done. Now, when the first tooth appears, say by around 6 months of age, in some kids it might take maybe 1 year. So whatever comes first. Basically, if there is a tooth in the mouth, you have to clean it. And for kids as small as 6 months of age, you can use a very soft, small finger toothbrush, what we call soft silicone bristles. You have to clean them. It's not that my baby is small, I will not be cleaning it, without using any toothpaste. Simple silicone, finger toothbrushes are there that can be used. Then coming on to toddlers between 1 to 3 years of age, now this is actually the best time to introduce a toothbrush to a child. And obviously the motor skills are not very developed, so the parents have to brush their child's teeth. And the toothbrush has to be very, again, with very soft bristles, smaller toothbrush head. And yes, the toothpaste that you will be using would be a non-fluoride toothpaste. It should be non-fluoridated. And fluoridated toothpaste, yeah, the toothpaste containing fluoride should be used in children above 3 years of age. Now, coming on to the other age group between 3 to 6 years, again, the brushing technique should be supervised. The parents should help, brushing the teeth, because this time they start brushing between 3 to 6 years. They start brushing their teeth, so it should be supervised. The parents can assist them. And a fluoride toothpaste, as I earlier said, fluoride toothpaste can use. Now, between 6 to 12 years of age, now they have enough of motor skills, enough dexterity to to start brushing on their own. So yes, sometimes a little bit of monitoring or reinforcement might be needed. That can be done by the parents, and you can introduce a fluoride rinse or floss at this time. Yeah.
Can you share some tips on proper brushing techniques?
In Before the technique, well, the positioning is important. In small children, small babies, you have to keep them on their lap, and then try and clean the gum pads or brush their teeth. And for older kids, you have to stand behind them facing the mirror, and that helps you get better access for cleaning their teeth. Secondly, the amount of the toothpaste that needs to be there on the toothbrush. For kids less than 3 years of age, a rice grain size of toothpaste is enough. And for above 3 years of age, a pea size toothpaste, a pea size amount of toothpaste is needed. Now, how do you hold the toothbrush? It is actually, the bristles are supposed to be at an angle of 45 degrees to the gingival margin. Gingival margin means where the teeth and the gums meet. At that area, or at that line, at the gingival line, the toothbrush has to be at 45 degrees angle. And then it has to be, the motion has to be very short sweeping motion. From that line, from the gingival line, you have to move towards the chewing surface and cover all the areas, inside, outside. But regarding the front teeth, the toothbrush has to be vertical. you have to hold it vertical and clean it. And again, soft sweeping motion. And for 2 minutes, the duration would be 2 minutes twice a day. Everybody knows that. And then finally, you have to focus on cleaning the roof of the mouth also. That is the palate and the tongue very gently. And then finally, spit and gargle. And try and establish an oral care routine very early, and in your child's early years. And that's going to actually help in their long-term dental health. So these are very small, short tips that you can, inculcate for efficient brushing. This is the proper technique, I would say.
How to get children to brush their milk teeth daily?
Yeah, that is one thing. See, the mantra is just to, make it fun for them. So the childrens are like, they're like cute little monkeys. They will just mimic whatever you do. So if you want them to brush teeth, just start enjoying in front of them, start brushing the teeth, start dancing, do just they should think, okay, this my mother or my mama or my papa is doing this and in such a fun way, I should also. So that is like they are like their parents are the role model. So whatever you do, they will mimic. So that is something, and that is actually you toothbrushing can be actually a bonding time with your child also. You can bond with them at that time. Another thing that you can do is to make a sing a toothbrush song. You have like this is the way we brush our teeth early in the morning and whatever I mean whatever the kids love. So you can in a sing song way also it can be done and you can teach the technique also like up and down or whatever like the you know your kids better so you can do it in a sing song way or you can the third way you can do is to play their favorite music groove along brush along that can be done and experiment with the flavors of the toothpaste. Sometimes they don't like the flavor of the toothpaste, so you can try experimenting with flavors. Get them bright colored toothbrushes, their favorite cartoon characters, whatever excites them, and yes, and then story time is also one thing. Using the story time to teach them, the benefits of brushing and what are the consequences if they don't brush. You can use their favorite character of the story, to teach them these things. And last but not the least, the reward system. You can give them incentives because they work, very well with the children. But that should not. You should not make the rewards the only reason your child brushes his teeth. But they do work well, in case of children. You can reward them when, they start brushing on their own independently and when they no longer need, reminders for brushing them. Yeah, so make it fun.
A very common question asked by the parents nowadays: how to choose oral care products? What factors do parents need to keep in mind?
Yes, agreed. Yes, a lot of products, it can be pretty daunting and confusing for the parents to choose, the right toothbrush or the toothpaste. So, considering the toothbrush, already mentioned, age appropriate with the right toothbrush head size. This head should be small, very, very soft bristles, so that it does not hurt their gums, and at the same time reach every nook and corner of the mouth. So that would be regarding the toothbrush. And for the toothpaste, again, age appropriate already mentioned before 3 years, non fluoride toothpaste, after 3 years, fluoride containing toothpaste. And yes, it should have a very low abrasive formula. Why? Because the enamel is very soft. So you want to use a very and robust anti cavity formula. So these three things to be kept in mind before purchasing a toothpaste for your child.
The next question is: why is visiting dentist regularly important, and how often to see a dentist?
Be it children or adults, it has to be every 6 months. 6 months is recommended. And if the child is prone to caries or cavities or other oral health problems, then the visit might be maybe even lesser than 6 months. He might have to visit more often. And for children, to visit a dentist, it's for the routine examination, like to diagnose any kind of oral health problem which is developing. Second thing that can be done is the preventive care. Preventive care in the sense, if we see that a child is more prone to caries, more prone to caries, we can apply, there is something called as spit and fissure sealants or fluoride varnishes. So these preventive measures, they prevent, caries developing in the child. Other thing that the parents are usually not aware of, that the dentist can usually deal with, is that some of the kids, they have adverse habits. Apart from the oral hygiene, they have adverse habits like nail biting, and they will be mouth breathers or thumb sucking, tongue thrusting. So these are the dentist can help them, quit these habits, and they can fabricate appliances which they can wear to intercept these habits. So that is the reason also you should visit a dentist more often. And sometimes, as a maxillofacial surgeon, also I have seen kids coming up for routine checkup, and they end up having, bigger problems in the sense that they might be having a oral cyst developing with impacted, milk teeth, and they might have to be operated surgically as well. So these are, I'm not saying in all individuals, but if you actually visit a dentist every 6 months just for a routine checkup, certain things, certain, dangerous things can be taken care of before they become really adverse and worsen off. So yes, every 6 months is recommended.
Nowadays, as we all know, children, they love to eat junk food. So, what foods to avoid your tooth health in children and when to call?
There are some very tooth unfriendly foods, but children love to have them. And they are the topmost one is carbonated drinks, then packaged fruit juices, sweets, candy, mm, potato chips, pickles, citrus fruits, popcorns. I know children love to eat these things that can be harmful to their teeth, but we as parents have to keep a check on them and, feed them the right foods. Yeah.
Thank you, Dr. Faria, for joining us today and sharing with our audience various ways of inculcating good oral habits in children from a young age. It was really good to talk to you. I am sure these tips are going to help many parents out there. Thank you to all our listeners for tuning in. Thanks to all our listeners for tuning in. This is your host Shweta signing off. If you like this episode or have any comments or feedback, you can reach out to us at soundcloud.com/smartcast. Do allow us for more such interesting and inspiring podcasts. Goodbye and stay safe.